Imagine waking up and feeling like your own body has become a stranger. For millions experiencing menopause, this isn't an exaggeration, it's their reality. One condition that adds to this challenge is Genitourinary Syndrome of Menopause, GSM. Even though it affects nearly half of menopausal individuals, GSM often goes undiagnosed. Why? Because people feel embarrassed to talk about it. But here's the truth, staying silent doesn't solve anything. Let's break that silence today. What is GSM and why should you care? Menopause marks a time of significant hormonal changes, and one major player in this transformation is estrogen. Estrogen isn't just a hormone, it's a multitasker. It manages puberty, helps regulate glucose and insulin, and keeps your bones strong. But as menopause sets in, estrogen production from the ovaries drops. This decline triggers GSM, a chronic condition affecting the vagina, vulva, and lower urinary tract. The body's response to low estrogen. Why does a simple reduction in estrogen have such a powerful impact? Estrogen receptors are sprinkled generously throughout tissues like the vagina, vulva, urethra, and bladder. These receptors are like keys that help maintain skin thickness, elasticity, muscle function, blood flow. When the estrogen level plunges, the body responds by changing the anatomy and function of these areas. What was once healthy, supple tissue becomes thinner, less elastic, and prone to discomfort. Who's more at risk? GSM doesn't play favorites, but certain factors increase your odds. If you're in menopause or approaching it. If you've had an oophorectomy, surgical removal of the ovaries. If you've smoked or abused alcohol. If you're abstinent or have reduced sexual activity. If you've undergone certain cancer treatments. If any of these apply to you, it's wise to stay informed and proactive. Symptoms you shouldn't ignore. Many people might dismiss symptoms of GSM as just part of getting older, however, this misconception keeps them from finding relief. Here are the common symptoms. Vaginal dryness that doesn't improve, painful intercourse, itchiness and irritation, decreased libido, urinary urgency, frequency, and even pain during urination. Since these symptoms overlap with other conditions, diagnosing GSM can be tricky. However, if these signs sound familiar, it's worth discussing them with a doctor or gynecologist. Why do we avoid talking about GSM? Embarrassment. The stigma around discussing vaginal health is real, and it's powerful. For many, GSM is synonymous with shame, leading them to stay quiet and suffer. But that silence can make life unnecessarily difficult. Think of it like having a pebble in your shoe, uncomfortable, persistent, and only getting worse until you do something about it. The power of a diagnosis. If you suspect GSM, don't panic. A diagnosis starts with a simple conversation and a pelvic exam, where the doctor checks for physical changes associated with GSM. Sometimes, additional tests are done to rule out other issues like sexually transmitted infections, STIs. Let's talk treatment. Relief is possible. If you're nodding your head thinking, "This sounds like me," there's good news. GSM can be managed. The main treatment goal is to relieve symptoms and improve quality of life. Here's how. 1. Local estrogen DHEA therapy. Think of this as a targeted solution. Low-dose vaginal estrogen is inserted directly into the vaginal canal, either as a suppository, insert, or ring. Why is it popular? Because research backs it up. One review analyzed 44 studies and found local estrogen therapy significantly improved vaginal dryness, painful intercourse, and urinary symptoms. It even reduced recurrent urinary tract infections. DHEA, another option, is a hormone that converts to estrogen in the body. Studies show it can boost sexual arousal and increase libido, making it a promising alternative. 2. Systemic estrogen therapy. When local treatments don't do the trick, systemic estrogen therapy can be an option. Taken orally, it circulates through the whole body. One standout medication is aspamifene, which helps reduce vaginal dryness and improve tissue health and sexual function. Research from 2019 confirmed its effectiveness in balancing pH, reducing pain during intercourse, and promoting overall vaginal health. 3. Topical lubricants and moisturizers. If estrogen isn't suitable for you, don't worry. Topical lubricants and moisturizers offer relief without altering hormone levels. But not all products are equal. Choose ones that are pH balanced and mimic the body's natural lubrication. Unbalanced products could actually worsen symptoms. Exploring experimental options. Medical research is always advancing, and GSM treatments are no exception. One area being studied is fractional laser therapy. This treatment enriches vaginal tissue by boosting circulation and elasticity and has shown promise in improving pH balance and reducing urinary symptoms. However, keep in mind that more research is needed before it becomes mainstream. Why treatment matters beyond symptoms. GSM can feel like a prison of discomfort. It affects not just your body but your confidence in relationships. Many who deal with painful intercourse find their intimacy takes a hit, which can lead to emotional strain. Addressing GSM isn't just about physical comfort, it's about reclaiming your life. The sooner you seek treatment, the sooner you can experience relief and regain a sense of normalcy. How to start the conversation. It may feel daunting, but the first step is simply acknowledging that your health matters. Your doctor has heard it all before and is there to help, not judge. Prepare for your appointment by noting your symptoms, when they started, and any factors that worsen or improve them. Final takeaway, you're not alone. GSM may be underdiagnosed, but that doesn't mean you have to suffer in silence. Whether you're dealing with minor discomfort or major disruptions to your daily life, there are treatments that can help. Remember, reaching out for help isn't just brave, it's smart. Menopause may be a natural transition, but that doesn't mean discomfort should be your new normal. If you're experiencing symptoms, book a visit with a medical professional. Be open about your symptoms, even if they're hard to talk about. Explore your options, from lubricants to local estrogen treatments. Know that relief is within reach. Don't let GSM dictate your day-to-day life. You deserve to live comfortably, with confidence and peace of mind.